Rob Shapiro from Technique Peak. Let's say with our patient, we found out we did some muscle testing we had talked about in the past, and let's say we found we think we need to do some work on the multifidi for strengthening. There's multiple ways. One way to I like is I have them do. Let's say we'll do this side. I tell the patient, come up enough, and I want you to relax your leg to start. Make sure the tone's low. I want you to think about you're just going to unweight your thigh a little bit from the. That's it. And if you could see, and come back down. Now, the key is when you do that and you do it right and you're really close to the spine, as they do it, it should push your finger straight up. If they're cheating, they're using the muscle next to it, longissimus. If you're too far out, it'll push your finger more laterally. So that's a kind of a nice way, a hint. So let's say I think I'm on multifidi, but I'm too far. So here's the spinous process. I'm out just a little bit. I'm right next to it. I think I'm on multifidi. Gently unweight your thigh just a little bit. Hold 2, 3, 4, 5. Relax. That was good. But if I'm too far out, relax. Relax again. Right, they'll try to relax even more. Let this go. There you go. And then what you do is try to lift. Try to do it again. As soon as I do it, you can't see it, but as soon as he lifted, if I was too far out, my fingers went laterally. That's how we know it's not a multifidi activation. So the key is to know that it's right next to the spinous process. And then the patient, so when you teach the patient, so I want you to take your finger back here. Okay, and relax see if you can get your fingers the other way. Can you get your fingers down? Good. And relax it's hard to relax, but keep your foot up. Okay. So he's a little bit stiff. As soon as he goes, he activates. So what I want you to do is unweight your thigh. That's it. See how light that is? It's just unweighting is a really good way to get multifidi to kick in. So if you can't get them to do it, you could do isometrics, or this is a really nice way to start to activate. If they don't feel it, thank you. Sometimes they'll try to lift their whole leg. It's not a hip extension exercise. It's an unweighting exercise for the thigh. So it's a really nice way early on. There's a good study by Zoe that says you do 10 seconds, 10 times, 3 sets of that, 2 or 3 times a day. And in 2 weeks, you'll see multifidi tone increase. So it's a lot of work for a patient. You got to teach them multiple ways to find multifidi. We could do some stuff in sitting. We could find we'll do another video and find other ways to get it. But the more they can do it, they actually can change their tone of the multifidi.